Thank you, John, and thank you for actually setting a really good theme for this meeting and for actually directing us into talking about topics. I found that very helpful. No support other than Orthopaedic Outreach sending me on trips occasionally. To help you understand the Pacific, there are three main regions. You have Micronesia in the north, you have Polynesia in the east, and Melanesia in the middle, okay? So Micronesia are the small islands like the Federated States, Marshall Islands, the northern ones. PNG is the main Melanesian, but includes Solomon Islands and Vanuatu. And then to the east, you've got the very small islands, Samoa, Tonga, Kiribati, to the east, and the Cook Islands. For the last 7 years, I've been running a training program. Initially started as a 4-year program, it's now a 3-year program, and it's modular. And what I did was took all of orthopaedics and broke it down into these modules. There are 12 altogether. We do 2 modules at a time now, twice a year over a 3-year period. And then at the end of that, there's a capstone experience. And Areta has experienced that. Each module is 3 weeks. And the trainees are brought together from wherever they are in that vast ocean. And that vast ocean is bigger than the whole continental United States or Europe, to give you an idea of perspective. And these guys work in these small islands, 180,000 people, and they're the only doctor, surgeon looking after trauma in that place. So imagine yourself in that situation, the isolation as Areta described it. And what we've been able to do is build that into a group and a fellowship. We bring them to a location where we'll run a module for 3 weeks, and they do the module and they go back and they can keep working. The benefit of that is that they can still continue to serve their country. We're not pulling them out for training for 3 or 4 years. It's also useful that they're only away for 6 weeks a year, much better for their families. And it also means they're much more likely to stay and serve in the long term in their own country. So what are some of the joys that I've experienced? The first joy is just being in the Pacific. As Michael has said, it's just so much fun with the guys. They laugh all day, we play practical jokes all day, we do sport in the evenings, and we just have fun. Seeing the lights come on, seeing my students understand the principles, watching trainees, senior trainees is like Stephen teaching the junior trainees, and now in the last 2 years watching my first students become consultants. So just to give you some examples, some brief examples over the last 2 years, I've had 50 consultants who have come and taught at these modules. So it's not something I've run alone. And of those 50, a third have been Australian, a third New Zealand, and a third from Switzerland, and 1 French Canadian who was here on a fellowship in Adelaide at the time. We do a lot of focus on clinical examination and history taking because that's the bedrock of orthopaedics, and practicing that. You can see David Bartle from New Zealand, Sarah on the bottom on the left from Cairns, Stephen on the bottom here teaching, and some of the Swiss guys, Nick Friedrich up in the top, who's Professor of Knee in Basel. We also try and teach research methodology, and Nick is a professor in Basel, and he came and helped to teach that, and that was fantastic. In addition, we do ward rounds where each morning a couple of the students are given 2 patients each, and they present it to the group of us. They take a full history and examination and all the management, and we discuss what was done well, what could have been done better, and they're learning from each other. And then in the afternoons, we'll do practicals. So this is Ponseti in Samoa, obviously appropriate. Learning how to measure pediatric scoliosis angles using your iPhone. Using the inclinometer on an iPhone can give you a very accurate measurements of angles. Learning how to do splats. This is my colleague, Dr. Eka from Bali, who one of the good things of my connections is I've dragged the Indonesians across to come and help us in the Pacific. And Dr. Eka has come twice now to teach the tumour module, teaching our guys how to deal with tumours, because we don't deal with them in the Pacific. Anyone in the Pacific who has a tumour will die because there is no treatment at the moment. There's no chemo, there's no radiation, none of that going. So Eka's starting to help us develop systems. And just in the last couple of days on the Viber chat group, got some pictures of a patient in Nonga in PNG, in Rabaul. And so talking about, okay, this is what you would do in terms of biopsy, this is the next step, and we'll teach those principles. In February this year, we did the upper limb module, and Graham Gumley's here. If you're wondering why there's a chicken on the bottom there, Marty, it's not because that was lunch, but this is teaching microsurgery. So we bought local chicken legs, and we use that. I got loops from China for about $50 each, got micro instruments from China for $50 each. Every student went home with them. And my students were able to, with Graham's expert teaching, in 3 afternoons, they went from never having seen any micro instruments and never having used it to a 15-minute nerve repair in 3 afternoons. And that was just amazing to see. And they've gone back and they're using these already. That was in Madang. And then the knee and foot and ankle just completed in Kundiawa. Again, Nick Friedrich there. We had a knee model for knee arthroscopy and teaching lots of different techniques. So training in the Pacific works. You learn from focused ward rounds. You have lectures from experts in the specialties and do sawbones practicals in the afternoon when people are falling asleep after lunch. Separate to that, we need to have individual mentoring visits. We need to have people coming in and visiting and working with our students one by one, and that's where all of you come into that place, where you can help. If you want to do a visit to a location, put your hand up, email me, contact me, and I'll connect you with one of my students, and you can then build that into a long-term relationship where you might do that once or twice a year, and we'll help you if you need help with your airfare or that kind of thing. The second big win, obviously, is the graduation, and this was 2 years ago with Stephen, and you've just seen those photos as well. To see these 4 guys come from starting off, some of them, one started in 2013, and the others started, two started in 2013 and the other 2 in 2015, and to see them pass the exam, and I'm sure, as Areta said, that he will pass next year. I'm very grateful to the examiners. So we had 2 senior examiners from New Zealand, the last 2 chief examiners, Peter Cundy, senior examiner from Australia, and Andreas stood in as well, and they ran an exam exactly like the exam we run here. 2 written papers, 2 clinical vivas, 3 computer stations off a similar standard. So I'm very, very pleased that the guys, 80% pass rate's fantastic, and I'm very grateful for that. Viber we've talked about, so and similar pictures. So I moderate the forum. We get lots and lots of questions all the time. But the other benefit, as Ray said to me just yesterday, is when he's operating in Kundiawa up in the Highlands in PNG, and it's 9 o'clock at night, he can put a photo and some questions up, and he'll get an answer, if not from me, from one of his other colleagues around the Pacific. And they'll give him advice, and he doesn't feel so alone anymore. Zoom has been fantastic. We've used it for the last year. So for the last year, every Sunday I did a tutorial for the guys coming up to the exam. And the reason I put this photo up is because now Sean on the top left and Alex on the left in the middle, who are guys who just passed the exam, they're running this now every Sunday for the guys who are going to do the exam next year. So this is part of our developing a future to make sure that we have succession planning, as Michael was saying. So today we've had 5 graduates, we're building a fellowship, and we're supporting and encouraging each other. And that's this family thing of really connecting these guys who were so isolated before. Some of the victories, technically, so the TENS nail is now in Samoa and in the Solomons and working. We've got the sign nail system in Solomons and in PNG and Lae. Ponseti is in Samoa, Solomons, and Kundiawa again and functioning well. Kundiawa is doing good work in spine in TB and is the only place in the Pacific that is doing spine that I know of. And we'd like to expand that. So we're trying to find centres that we can develop as places where the guys can go and learn extra skills. You've seen the 10 stuff, so I won't labour on that. PNG is now established. We have 11 trainees, but we're getting a lot of resistance from Port Moresby, from the School of Medicine there. They think that we're a competing program. I've tried for 8 years to partner with them. I keep going to talk to them, and they're not interested. And so I don't know how to fix that problem. But these are the guys around PNG. So we have in the Highlands Anthony and Raymond and Bohu up in the Highlands. We have Stephen James in Lae. We have 3 guys who are currently in Moresby, but who will go back to Manus, to Popondetta. And then we have guys in the islands to the east. So Viola, who's our very first female trainee, we hope to have another 2 female trainees next year. And then Felix in Rabaul, as well as Kevin. And then in Bougainville, our first trainee this year, from Haynes Russin in Bougainville. In 2019, we also got our very first trainee from Timor. So that's our 9th country now in the Pacific that has joined us. And so these are all the guys spread out. Johnny Hedson way up north in Micronesia, and all the way to Naseri in the east, who's an American Samoa on the other side of the date line. Some of the challenges. The number one challenge anywhere in the Pacific is X-rays and II. X-ray machines, when you bring them into the Pacific, the local rats say, "Thank you very much for my Christmas gift," and they make a home in them, and within 12 months they've eaten the electrical cables. And that's one of the reasons why if you go anywhere in the Pacific, you'll see II machines which are used as clothes hangers and where something is broken. This may be a solution on the right. This is a device called a battery. It's a device about this big. It's battery operated and it does digital X-rays. It's a completely sealed unit. The receiver is a digital receiver, and this American guy has put this together. It's functioning in Compiam in New Guinea since late last year, and it basically transmits from the digital receiver wirelessly to your laptop an image in 2 seconds. So I've got in contact with these guys to see whether they can convert that to an II with a C-arm for us. That would be the next step in the and that's not hard. It's just having a C-shaped rotating arm, really, and that may be a solution for all of our Pacific hospitals where X-ray and II is a problem, because that's a big issue. Trauma implants are an issue, and as Marty said, that's a really big issue. I think we need to move beyond donations. I think we need to link up with these countries to help them to get regular ordering, and that means affordable implants, and sometimes that means India or China, but it needs to become a system, as Michael said. So if it's just donations, it's just never going to be sustainable. Okay, they can afford the ones from India and China, and they can use them, and that will make a difference for long-term sustainability when we've pulled out. So Narang is the people I use in Delhi, but there's a whole bunch of very high quality suppliers now out of India, battery operated drills from China as well. The biggest challenge has been understanding culture and time. And so Pacific cultures are very relational, and relationships and family are very important, and Swiss time not so important. So we need to learn how to adapt to that. Communicating with people is an issue, and I'm really proud of my guys because they now reply within 12 hours to anything that we do, and that to me has been the biggest victory. And so encourage that communication. Negotiating with ministries of health is complex, and with employers is complex, and every module I run, I have one last-minute phone call, my passport's expired, I don't have a visa, or I need to change my ticket, somebody's sick, and then I have to juggle around that. So that's always a challenge as well. The other disappointment for me has been that slow pace of change, and especially the two big centres, so Suva, the University of the Fiji School of Medicine, and Port Moresby, the UPNG, and their complete lack of engagement in offering the training. We've kept saying to them, we want to partner with you, we'll help you with the structure if you want, but no, they don't. We've had a couple of trainees who've dropped out, that's a sadness as well. And I think the biggest one for me is that the administrators in the centres where our trainees work don't actually understand the amazing job our trainees are doing. And for me, that's a frustration. As Areta said, we do now have a signed, fully agreed partnership with the National University of Samoa. Stephen got his official certificate, his Masters in Surgery from them in April of this year. And next year in Apia in Samoa on the 3rd or 4th of April on the Friday, we will have a graduation where 4 of our guys will get their Masters of Surgery in Orthopaedics. If you know of anyone in the Pacific that you visit who wants to train, then applications close at the end of this month. We have a bunch of people who help us, and I want to acknowledge Klaus, who's in the room here from AOA Alliance Foundation. Hans-Jörg Weiss is the guy who used to own Synthes. He gave us our initial grant in the first 4 years, and then since then he's been funding it through AOA Alliance Foundation. But we have a number of partners, including Outreach, including Ortho Pacific's Trust, which is the New Zealand equivalent of Outreach, out of Tauranga. AOA we're affiliated with. We're a member of PIOA and the International College of Surgeons. In the future, we have 16 more guys and 1 girl who will graduate over the next 3 years. So that's a very exciting pipeline as they do their exams. We at the moment have funding for the next 2 years that's guaranteed. So anyone I take on next year I don't have funding for their third year, but we'll work that out. We're in negotiation to continue that. I would like us to run the first Pacific Island Orthopaedic meeting in 2021, sometime in the middle, and that would be a wonderful thing, and maybe that's something that DFAT can help us with. Next year, the plan is that our first graduates would work as observers in the exam, so that by the following year, a couple of them can be trained to be examiners for their setting as well, where they would partner with our visiting Australian and New Zealand examiners. And sometime before I die, I would love to see our program recognised by you, the Fijians and the PNG guys. Or maybe if I'm dead, you can tell me about it anyway. These are the modules in the next year. So in April, March and April, we'll be in Apia and Samoa, and then in August we'll be doing hip and infection and inflammation. And I just want to talk about that infection thing. So our second module, I got an infectious disease consultant who came and taught at it, and from that came the antibiotic guidelines for for the orthopaedic guides, which became the guidelines for the hospital, which became the guidelines for Solomon's, which then got copied by Fiji, etc. So that's fantastic. Now, from that interaction, that infectious disease doctor has built a similar organisation called the Pacific Region Infectious Diseases Association, PRIDA. And I would encourage you to contact them, because they now have 50 clinicians who are involved in doing infectious diseases in the Pacific, with lots of hands-on experience from nurses, infection control nurses, microbiologists and ID doctors. So that's one of the great kind of connections that we've been able to build. Thank you very, very much, John.